We appreciate you joining us on In Focus Kentucky. On today's episode, we are focusing on a pilot program at the University of Kentucky that is tackling the issue of non-emergency calls bombarding the 911 emergency system in the city of Lexington. But we also wanted to have a statewide perspective on this topic, and in our studio now is Michael Pointer, Executive Director with the Kentucky's Board of Emergency Medical Services. Thank you so much for joining us today.
Thank you for having me.
Absolutely. And how does your organization utilize data to research to help make the EMS workers and the community more efficient?
Yeah, data is so important in what we do. 10 years ago, we couldn't tell you how many EMS runs or calls were made. We didn't have a established data program. Since then, we've established that where the providers actually have to give us data each month on what they do, the patient contacts and the numbers. So it really helps us in research and knowing what's going on out in the Commonwealth and try to better the level of patient care. So that's the most important thing, is research and patient care improvement.
And I was reading that there were, for 2018, there were over 13,000 certified and licensed EMS providers in Kentucky, and about 600 plus emergency medical responders. And you're telling me that you actually oversee training for all of these different folks throughout the state?
Right. The Board of Emergency Medical Services, we oversee all the first responders involved in emergency medical services, which, like you said, we have close to 14,000 first responders. We oversee the training institutions to make sure they're compliant and producing good quality first responders. So it's really important for us to have the quality responders for the Commonwealth.
And what about this community paramedicine program? What is that and why is it important to have?
Right. Community paramedicine, or it's also known as mobile integrated healthcare, is a new program for emergency medical services. It's something we're filling a gap in healthcare. Normally you think about emergency medical technicians or paramedics in the back of an ambulance, and that's about it. But we're doing so much more with the training that we've got in the evolving healthcare. We're involved in helicopter transports as crew members. Paramedics are working in emergency departments in hospitals. So we've got more paramedics than we've ever had, but we're doing a lot more than we've ever done. So we're seeing some shortages in some specific areas. But mobile integrated healthcare is a program to help reduce the impact of super users, folks that call 911 on a regular basis that's not always needed, to prevent hospital readmissions after, if you get discharged after 30 days, but if you get readmitted before 30 days, they don't get reimbursed for that. So we're trying to prevent readmissions like that. So we've got paramedics and EMTs that are out on the street working with this program. It's working out really good, our data shows.
Now, our high volume of non-emergency calls at dispatch centers, is that a common theme that is across Kentucky, or is it, do you have numbers to show on that?
It is, and you see more predominant numbers in the urban areas and higher populations of the super users that call frequently and more often. But with the data that we're seeing, we're able to pinpoint those folks, and the community paramedics and responders are able to meet with them and talk with them. And introduce them to social workers, things like that can help prevent that and reduce healthcare costs.
And why is it important to have an organization like yours here in our state of Kentucky for the EMS community or EMT community, but also just for the general public?
Yeah, well, the Board of EMS, we're sort of the program that oversees emergency medical services. You've got the Fire Commission, which oversees the fire service, and the law enforcement training centers, which does the same thing for law enforcement. So we specialize in specifically emergency medical services and the medical care for that. So our main job is to make sure we have the best providers, the best equipment, and the best care given to the citizens of the Commonwealth.
Well, Michael, we are really appreciative of you joining us here on the program to talk about the services that your group provides on behalf of the state, and we appreciate your time today.
Thank you very much.
Absolutely. Now, that's all for today's show. We thank you for joining us. You can go online right now and see this or any past episodes of In Focus on our website, spectruminfocus.com. And as always, you can keep in touch with updates about the show throughout the week by following me on social media. But until next time, have a great week.